High risk, hostile, unwelcoming. The damning indictment in a leaked report into the running of Alder Hey's operating theatres unit. And it was written by its very own director of nursing. The hospital trust admits there have been difficulties for some time, but says it has taken a range of measures to address them. Our health and social care correspondent, Victoria MacDonald, has this exclusive report.
It's one of the busiest children's hospitals in Europe. 270,000 patients are treated every year at Alder Hey in Liverpool, and for years it had an enviable international reputation. But there are problems here. In fact, what appear to be serious problems. Not in the whole hospital, but in one specific yet crucial department, the operating theatres, where some of the most complex treatments for some of the sickest children are performed.
Now Channel 4 News has been leaked this document. It's an internal review of that department prepared last month by the Director of Nursing, Jill Kaur, and it paints a picture of a unit in trouble.
This document is, in effect, a safety alert. Shortcuts, it says, have created high-risk activity. Reporting of incidents, that is, near misses and mistakes, are described as limited. And there is a belief that the senior management and the board are aware of the working conditions and condone it.
If I was a member of the board of this hospital, I would be mortified. I mean, it's one of the great child hospitals in the country, and there are clearly serious issues at stake here. And while it's good that they've had a report, it's good that the report has become public, I'm worried about how the board has behaved up to now.
So just to be clear, it's not that you're unable to put anybody up, but it's that you don't want to put anybody up. We asked for an interview with the Trust's chairman, Sir David Henshaw, with the Trust's chief executive, Louise Shepherd, with the medical director. In fact, we asked for an interview with anybody in a position of authority. They all refused to speak to us.
Throughout the review are references to a department that is under considerable strain, is even at times in crisis. Indeed, it says, some individuals have reported that the working environment is hostile, and there are numerous examples of staff feeling pressurized to undertake activities that they do not believe are safe. And there are complaints that it's not welcoming or child-friendly. This in a children's hospital. The report acknowledges the massive effort of staff who, it says, are doing their best under the most difficult of circumstances. But staff, it says, have adopted some high-risk practices in order to avoid cancellations. While safe outcomes have been maintained, the level of risk is such that urgent action needs to be implemented to avoid an adverse outcome or serious incident.
Last October, the Care Quality Commission rated the hospital as high risk, one of only 44 trusts in England to be put into that category. And now we've learned that the CQC made an unannounced inspection here last December after concerned staff contacted them directly.
In fact, the Director of Nursing says in the review that it was to be regretted that the staff felt they had to blow the whistle to the CQC rather than speak to management.
It's very concerning that staff still felt unable to get their concerns reported to and acted upon by the Trust itself. But at least we can take some comfort that the safety net of the Care Quality Commission was there. They were listened to by them, and the CQC, I'm sure, have had a role in making sure these issues will be addressed.
This is not the first time whistleblowers have highlighted concerns, including safety issues at Alder Hey, though their accounts have been disputed by the Trust. And a report in 2010 revealed high levels of stress among theatre staff. It even talked of self-harm and suicide. And responding to this latest review, the Trust chairman said in a statement,
"We acknowledge that there have been difficulties within the theatre team at Alder Hey for some time. Over the past year, we have undertaken a range of measures to address these and make changes. We recognise that changes to the culture of the department may take time, and therefore we have made a long-term commitment to supporting the team."
Action already taken includes providing new toys and new scrub suits for surgery. There are changes to staffing, equipment checklists have been strengthened, and there is more training on the safety reporting system. Next door to the Victorian buildings which house the current hospital, a new site is being developed, and there will be new equipment and new operating theatres. But this review warns that they cannot wait for all that to happen. Change, it says, needs to take place as a matter of urgency. Action, it adds, is required immediately.